Professor Bruce Sanderson, who is the Vice Chair of University of Washington's Department of Orthopedics and Sports Medicine. He said that 1 in 4 people in the United States have flat feet, which means at least 6 people in this room is having flat feet. Even though you have the flat feet, you may not realize that the back pain, hip pain, knees pain, and feet pain you have after a 7-hour shopping is due to the flat feet you have. But don't worry about it, because today I'm going to inform you all how to identify and treat your flat feet properly. I chose this topic because I have had flat feet for 19 years, and I've done tons of research on this topic, so I'm pretty good at it. After this speech, I hope that at least you all will know whether you have flat feet or not, and have brief ideas on how you should deal with it. But first, I will tell you how flat feet is formed, and also I will suggest several methods on how to identify your flat feet, and lastly, maybe most of your concerns, how to treat it. There are several reasons in the formation of flat feet, but before talking about the causes of flat feet, you have to know what flat feet really is. According to Mayo Clinic, they say that you have flat feet when the arc inside your feet is flattened, allowing the entire sole of your feet to touch the ground when you stand up. What it means is that we can take a look at this picture. On this picture on the left, you can see that this is a shape of a normal feet. You can see that there is a significant arc inside the feet. And for this one, it's a shape of a flat feet, which you can see that there's no arc at all. And it fits the definition I just mentioned. When you stand up, the entire feet is touching the ground. Normally, imagine this is a tendon connecting your bones and your muscles. Normally, when you grow up, your tendons should go stronger and tighter. And this forms an arc, you can see here, to support the entire muscles in your feet. But what if it is damaged? Then the arc will fall. Then there will be nothing to support your muscles anymore. And it will be like this one. This one on the right is the flat feet. And you can see that since the arc has fallen, then the muscles fall. Then the entire feet is touching the ground. And where this one, when compared to the normal feet, is leaning inwards. And so it is the cause that causes your knees pain or hip pain. There are several reasons for this formation of flat feet. First of all, it can be inherited inside your genes. If your parents have flat feet, you are more likely to have flat feet than others. And also, after certain injuries and bone dislocation, your tendon might be damaged, and thus flat feet occurs. And there's another interesting fact from NHS Choice. They say that for women over 40 years old, they are more likely to have flat feet than any other else. That's because they often wear high heels, and the high heels might have given their feet a lot of pressure and might have changed their foot shape, and so that flat feet occurs. Even though now you know how flat feet is formed, you may start wondering whether you have a flat feet or not. And according to Seattle Children's Hospital, they suggest 3 methods. First of all is the toe stand method. When you're standing with your toes, if you have a normal foot, you should be able to spot a significant arc inside your feet. But if you do not, see the significant arc, which means you're having a flat feet. The other method is wet test. Wet test is performed by stepping one of your feet into water, then step on a piece of paper. Then here's the result. The left one is the result of a normal foot. You can see that there is a significant arc inside, which means when you step on a paper, not the entire feet is touching the paper. But for this one, since there is no arc at all, so that the entire feet is touching the paper. The last one is probably the way that you can think of, is consult a doctor or physician. A doctor or physician can always use the above methods to help you to measure your flat feet, or they might have certain devices to measure the degree of your flat feet as well. Knowing how you have deformity, like maybe you guys, maybe like what I did 9 years ago, keep searching for treatments. According to the New York Times, they suggest 3 methods. First of all is shoe inserts and orthotics. Orthotics is something that is a device that helps you to adjust your foot shape. And here you can see there is an arc support device. This device helps you to create an arc shape inside your feet, and so that it helps you to weaken the effect of the flat feet you have. And the other one is exercise. The exercise, they suggest that barefoot walking and toe running can help you to reduce the effect of flat foot. It is because when you are walking with your bare foot and running with your toes, then the inner part of your feet muscles is strengthening, and then it might have helped you to create an arc again. And the last one, which is a worst situation, is that when you have persistent pain that you cannot bear anymore, you have to go to the physician and undergo a surgery. And throughout the surgery, you have to reconstruct your foot shape, maybe by inserting an artificial tendon inside, so that you will be able to have a normal foot again. However, surprisingly, a lot of physicians and doctors do not suggest you to go to them. It is because it is so normal that if you are not severely having the flat feet, then you do not have to go to them. But even though they say it this way, I think it's better for you to keep track of the condition of your flat feet, just in case any pain occurs, you will know where to go to. Today, I explained to you how flat feet is formed, and also I suggest you 3 ways to identify your flat feet. And lastly, I suggest a few treatments so that you can have ideas to how to deal with your flat feet. As I said at the beginning of the speech, this deformity is so common that within this small room, there's already 6 people having this flat feet. Even though it's not deadly, but trust me, it's something that is disturbing your life. Like what I did after 2 hours basketball is pain as hell. However, I hope that after this speech, you can share the things and ideas you learn from this speech to the people you love and care about. Thank you.